what is heart failure, and we also have a graphic to kind of help illustrate what's going on with it.
Heart failure has many etiologies. It could be idiopathic heart failure, which we might not know what's causing it. It could also be caused by certain infections like viral infections. But for the most part, the heart failure that I encounter in the office is related to hypertension and diabetes. And just in a nutshell, the heart failure is basically, if you see here, the left ventricle becomes enlarged, and the cavity becomes enlarged, and the heart just loses its strength when it comes to pumping blood out of the left ventricle to the rest of the body. In a nutshell, that's what heart failure is, briefly. But it's something that we are seeing more often nowadays, especially as the elderly population enlarges in the United States. And it's very commonly associated with hypertension, diabetes, and coronary artery disease. I think that those three medical conditions eventually end up in heart failure.
Okay.
Laura.
And you mentioned that you are seeing this among the seniors because we are living longer, and we are seeing, I think, more conditions that are presenting themselves because of age. And perhaps this is too basic, but what you just described before with the graphic was the muscle is just getting weaker, basically.
Correct,
and
Laura.
that's something that happens with age, right? So it kind of makes sense to see that happening, the rising numbers amongst the aging population?
Correct, yes. And like we said, the population is living longer.
Yes.
In that graph, you saw the heart enlarged. Not all patients will develop significant heart failure towards the end of their life, but I think that we all do eventually will develop at a certain degree. But then if we add diabetes, if we add heart disease, if we had coronary artery disease, if you add acute myocardial infarctions, then the patient will likely end up with more of a severe heart failure.